Let's discuss some tips for calling providers. When I was a new nurse, I was terrified to speak to providers because I was worried that they were going to yell at me or hang up on me or, I don't know, ignore me. And, it's just one of those things that you really got to just put your big girl pants on and do because at the end of the day, our patients come first. There are certain things that we have to call about or communicate to providers about. And so you just got to get used to it and do it. And I'm going to give you some tips. This is from my new nurse crash course, but I'm going to go through the 4 tips that I give to people when they're nervous about talking to providers. First tip is know why you're speaking to the provider. Maybe this sounds obvious, but a lot of times I think we can kind of beat around the bush or give too much context when really this needs to be a very simple conversation because we're all busy. So for example, hi, Dr. So-and-so. My name's Ashley. I'm a nurse calling from the ICU. I'm calling about this patient because there has been a drop in their blood pressure. I can give other context after that if need be, but I'm going to start with exactly why I'm calling or just initiating the conversation. Number 2 is anticipate what you're expecting from the provider so that way you can come prepared. If I'm calling about hypotension, I'm anticipating maybe fluids, blood products, a pressor, maybe some labs, but you need to know what you're expecting out of the conversation to make sure that you're not calling again about something that could have been kind of, troubleshooted in that conversation, which leads me to my next point. Troubleshoot as much as you can prior to calling. A lot of times providers get frustrated because we're calling about things that we already have standing orders for or that we could have done something about other than just getting an order. So for example, if I'm calling about low urine output, I'm going to make sure that I've already flush the patient's Foley if they had one to make sure it's not just clogged up, or bladder scan them to make sure they're not retaining urine. I'm going to check over their labs. I'm going to troubleshoot as much as I can so that way when I call them and they say, well, did you flush the Foley? I can be like, yes, versus being like, no, I didn't. Have to go do that and then call them back. And now things are delayed. They get frustrated that you're calling more than one time. If you're unsure how to troubleshoot something, then ask another nurse and help use like their experience and reference for it. So that way we can kind of all put our heads together and make sure we're troubleshooting as much as we can before calling. And the last thing is only give pertinent and relevant information to keep the conversation short and to the point. Providers don't want a bajillion details in things unless they are necessary for the conversation. So try to avoid all the fluffy stuff and just give like bullet point facts. Those are some of my tips for talking with providers. Let me know if you have any questions.